Good morning, everybody. We are going to go ahead and get started with our webinar. Thank you all for being here. We are very excited to be presenting this information about Ashland County and the new partnership with Healthy Northeast Ohio. So we know that there might be a couple folks still joining. This webinar is being recorded, so afterwards we will send out the link to everybody who attended and registered for the event. We will also add it to our Healthy Northeast Ohio resource library so that it can be accessible to all of you. Again, to watch over, to distribute as necessary. So we wanted to make sure we made you aware of that. We will get started with just a couple of housekeeping items, and then we are going to jump right into our content this morning. So again, thank you for joining us. We welcome you. We are using the WebEx platform, which you probably know, and we just wanted to point out a couple of things, specifically the chat function. So as we're moving throughout the presentation, if you have questions that arise, we do encourage you to add those in the chat box and address those to all panelists so that myself and Sarah can make sure that we see those and address those. We will have time at the very end to address questions and answers, but again, as we're moving through different content, if a question arises, we are happy to address those on the if it's right there as well. And we will start with some introductions. So my name is Libby McGraw. I'm pleased to be here with you today. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio, and I am based at the Center for Health Affairs in Cleveland, Ohio. And Sarah, I'll let you go ahead and introduce yourself.
Thanks, Libby, and good morning. Welcome, everyone. My name is Sarah Zabo. I am a data analyst at the Cuyahoga County Board of Health, and I also serve as one of the website administrators for Healthy Northeast Ohio.
Thanks, Sarah. And we are going to move into our agenda for today. So we will kick everything off with a website overview. This will be pretty high level. We'll walk through just some basic functions and assets on the site. Then we will move into all things data. We'll talk about some resources that you can use and share, additional features on our site. And then, as I mentioned, we'll end with some questions and answers. And our objectives for today: be looking at some of our data trends. We'll show you how to access our different data at the regional level, at the county, state level, and we will share all of those great tools and hacks. We will also show you how to build some customized dashboards, reports. We'll show you how to access some of our resources that are available, different databases, and funding opportunities. So we're really excited, again, just to be presenting this information to you all. And since many of you are likely from Ashland County, we were really excited when Ashland County joined us. So we will move into some background information. I know some of you may be familiar with our efforts, and if you're returning to us today, that's great. Welcome back. If you are brand new to our efforts, we do want to set the context a little bit about who we are and how we got to where we are today. So Healthy Northeast Ohio launched the healthyneo.org site about 2 years ago, so we're just about to approach our second anniversary, and we do utilize the Conduent Healthy Communities Institute web-based platform, which you may be familiar with. You may have seen other products of theirs. But there are a lot of nice built-in features of the platform. So we're really excited to continue to partner with Conduent HCI for that. We currently maintain a presence in 8 counties in Northeast Ohio, including Ashland, our most recently added county, Ashtabula, Cuyahoga, Lake Lorraine, Medina, Portage, and Summit counties. And we will also be adding Geauga County later this year. We are funded by a grant through the HealthComp Foundation in Cleveland, Ohio, and we also receive generous partner contributions to allow us to conduct this work. So it's a great opportunity for the Cuyahoga County Board of Health and the Center for Health Affairs to work very collaboratively to reach the counties in our region. So we've been very excited these last couple of years to be working in this community health improvement space, and we're excited for what the future holds as well. And with that being said, we are going to jump right into our website demonstrations. But to kick us off, I'm also going to open a poll. So bear with me as I go ahead and open up this first poll, and it should be open now. So we are asking, have you used Healthy Northeast Ohio before today? And then Sarah, could you give me a thumbs up if the poll is showing? Thank you. Sometimes on the presenter end, it's great to have multiple people working on the webinar as well. So we'll go ahead and leave that up for just a few minutes, or just a couple more seconds rather, and then we will move into our website demonstration. So some of you may be a power user, some of you may use it, but only a little bit. Some of you may have heard it, seen other people use it, and some of you may have never used or seen it. And all of those answers are great. There are no wrong answers here. So I'll give it another second or two, but it looks like we're getting a nice variety of answers. So a lot of you have never used it, and that comes as no surprise since we are new in Ashland County. Some of you have used it, but only a little bit. So this is great to see. So I'm going to go ahead and close the poll. And we'll go ahead and display those results. And we are going to move into our website demonstration. Okay, and then Sarah, could you also confirm that you're seeing healthyneo.org? Okay, thank you so much. So I am healthy.org platform. This is a free and publicly available site, so we like to make sure we point that out, especially to new folks. There are no special logins that are necessary, no special passwords. The data that's available on this platform is free and publicly available. So our site can really serve as a great resource for health departments, those working in the public health space, those working in hospital systems, community-based organizations, and it's a really great tool to bring together community health data at various geographic levels. So we will get into all the specifics. You'll hear from Sarah in a little bit about all of our data, how to access it, and I know that that's what many of you will be very excited to hear about. So with that being said, I will just walk you through some of the key features on our homepage as we move into some of our other resources and features. So again, healthyneo.org. As you're navigating through our navigation panel here at the top, and pardon me, I went ahead and accidentally clicked, but if you click on our logo in the upper left-hand corner, it will always take you back home. So that's what I just did now, since I accidentally clicked on tools and resources a little too early. And then a couple other things we like to point out. In the upper left-hand corner, there are a couple of icons that will enable you to copy the URL of a page, save it as a PDF, or also print that page as well. So just a couple of quick tools that we want to point out. As I mentioned, we have our navigation panel, and this will take you to all the various pages on our platform. Right now, we are featuring our program accomplishments video on our homepage. So these are things that we were able to accomplish from 2019 up until now in 2021. So we do invite you to watch that at your leisure. We do have a search bar, so you can search for specific topics. You can type in a quick keyword, and that can get you started on searching for information on the platform. We also are featuring, as many others, COVID-19 information at this time. Another way that you can access our county pages as well as up in the navigation panel is through clicking on any of these buttons. And we'll be looking at the Ashland County page in just a minute. We also have a What's New section. So this is where we typically feature upcoming webinar announcements. So as you see, we have the Ashland County webinar right here. If we have new dashboards that we've created on the site, new data that's been added, we do also feature that in this section as well. We have a data spotlight, and this is updated monthly. And then at the very bottom of our page, we do have a list of all of our partners, and you can scroll through to view all of those. And if you were interested in learning more about that partner, you could click on their logo and it would take you to their page. The next page that I'm going to show is the Ashland County page. And again, you can access that through clicking on that button or by going to the Explore by County tab and clicking it in the dropdown. We have a county page for every county in the region, and all of them look very similar, but they might differ a little bit based on the content and data that we have available for that county. So right here, you'll see that we have a brief description of Ashland County, and as you scroll through this page, you'll start to see the specific links to access data for Ashland County. So in this top row, you'll see that there are demographics links to access the health indicators, socio needs information. We have a data scoring tool, which we will not be exploring today, but this is a ranking of the county level Ashland County indicators. And then if you continue to scroll through, you'll have access to all of the different links to view health assessments and improvement plans and implementation strategies for Ashland County. And again, these can be viewed for all of the counties in our region, but we wanted to make sure that we showed all of you where you could access that for Ashland County. Next, I'm going to take you to our demographics page. And I went ahead and clicked on the button through the Ashland County page, but another way that you can access our demographics dashboard is underneath the Explore Data tab and by hovering over the Specialty Dashboards flyout, and then you'll be able to click it right there. So we just wanted to make sure we made you aware of the multiple ways you could access our demographics information. We do have about 250 demographics elements that are updated annually, and this comes from Claritas. You can view all of our demographic elements by clicking on this purple button in the upper right-hand corner, and we have demographics variables available at the state, county, and zip code levels, so you can always change that location by clicking on the drop-down arrow here. You can also scroll through these different tabs or click through these different tabs to view the different topics within demographics. And for the sake of time, we won't go through all of those today, but I do want to slowly scroll down on this page so that you can start to see how dynamic our data visualizations are. And I will point out, and Sarah will probably touch on this a little bit as well, but all of our graphs that you'll find as you navigate throughout the site can be downloaded. So if you click on these 3 lines in the upper right-hand corner of some of our graphics, you'll be able to have an option to download as a JPEG, download as a PDF, or as a CSV file. So these are things that you could then import directly into a grant report, into a proposal, a presentation, whatever you would be using this information for. This is available at for your use. Next up, I'm going to show you another feature that's available underneath our Explore by County tab, which is our Healthy Northeast Ohio Regional Demographic Story. And this is something that was recently created, and we sort of created this because we received feedback from some of our partners that they would be interested in looking at demographics for all of the counties in the region, whether that's to compare or to really get a sense of what our demographics are at the regional level. So we were able to respond to this, and I have to give props to Sarah because this was all her, but she was able to create this demographic story where you could view these elements at the regional level as well. So I won't spend too much time on this. We encourage you to look at this, but if you continue, again, as we did on the demographics page, to scroll through some of these pages, you'll start to see how dynamic some of these graphs are. And again, you can continue to download these, as I mentioned previously. Okay, next up, I am going to point out our topic center. So at the bottom of every page, we have a footer that remains consistent as you navigate throughout the site. If you click on any of these icons here, you'll see things such as health, community, economy. This will take you directly to our topic center. So for our example, I'm going to go ahead and click on community. And here you'll see a page that has brought together all the content related to that topic that is available on the site. So we specifically like to point this out to folks who are newer to the platform, especially if it's a little intimidating to go through all of the different pages, look at all of the different data indicators. This is a really great way to bring together related content very quickly. So if you clicked on the drop-down arrow, you would be able to select a more specific topic even. So if you wanted to look at information about alcohol and drug use, it would bring together all of the content related to that. And finally, I will also point out down in our footer, we have some options to contact our team, which we'll talk about at the end as well. We have an About Us section for a little bit more information. We have a help center where you can enter any quick questions or keywords to help navigate through the site. But the one that I wanted to specifically point out is our FAQ page. And this is maintained by our site vendor, as you see here at the top, Conduit Healthy Communities Institute. And this is a great way to get some common questions answered. So of course, we're always available to our partners. If there are questions that arise, you can contact us directly. But if you have an immediate question, such as a common one, such as how do I cite data from the site, you can find a little bit more of that information at our FAQ center here. So again, we just wanted to point that out since that's something that we've heard across the region. And with that, I believe I am going to go ahead and turn it over to Sarah.
Thanks, Libby. Bear with me while I just share my screen. Okay. Libby, can you let me know if you're seeing
Yep, I'm
website?
seeing the indicator list by location.
Perfect. I appreciate it. Thank you. Okay, so as Libby said, in this next portion of our webinar today, I'm mainly going to be walking you through the Explore Data tab on the website. I'll show you how to search for data and then also how to create some custom data visualizations using tools that we have available to you. And as Libby said, Healthy Northeast Ohio centralizes that population health data to allow for comparisons and also collaborations across sectors. This data can be used for things like identifying areas of progress or need in your community. It could be used for setting priorities, goals, and tracking progress. Also to look at how your community might compare to other communities across the state. And it also can be used for program planning or even making funding decisions. So I'm going to start by showing you how to search for data on the site. And please keep in mind that there's a couple ways to do this, including the search bar that Libby showed you on the homepage. So I'm going to start by showing you the indicator list by location, and this is available if you went to the Explore Data tab and then clicked Indicator List by Location. And especially because we do have a fair amount of new users on the website, I really do like to highlight this. So basically, this list includes every single indicator that we have available on the website, and then it also shows you what geographic levels of data are available for those indicators. So right now we have more than 275 health and quality of life indicators, and these come from around 30 sources. So that's a variety of state, national, and other sources. And if you're really interested, if you go to the Learn More tab and then how to use this site page, we do have a graphic that gives more information on those data sources. I also wanted to mention that the indicators that are on the site are curated and maintained by our vendor, Conduent HCI, with the exception of some local data that we added, and I'll get more into that in a little bit. And then as Libby also shared, we have data for the 8 counties that are in our region, as well as the municipalities, zip codes, and census tracts that make up those counties. So in this list, you're going to see all of the indicators are organized by topic and then subtopic. So for example, I'll scroll just a little bit. If you were interested in looking at data related to cancer, it's kind of just like a nice snapshot just to see what we have available. If, for example, you know you wanted to look at data at a sub-county level, here you could look to see which ones are available, for example, at the zip code or census tract level. And you can click on any of the indicators on this page to get more details about it. And this list can also be downloaded. So again, that is the indicator list by location, and I do encourage you to check this out. So a second way to search for data that I'll show is going to the search for data page, again, under that Explore Data tab. So on this page, as you can see, you can do a keyword search, you can use these drop downs to find a specific indicator, or you can even look by a specific location. So for the sake of example, I'm just going to go ahead and do a keyword search. So I'm going to go ahead and type in arthritis, if I can spell. And once you've typed in your keyword search, the website then is going to pull in all of the related indicators that would be available to you. And we did note that chronic disease was a priority in the Ashland County CHIP. So that's why I'm showing this example. So say I'm interested in learning more about adults with arthritis. All you would do is click on that indicator. And next you're going to be prompted to select a location. So using this drop down at the bottom, I'm going to go ahead and select Ashland County. Okay, so now you are taken to what is called the indicator detail page, which again is where you can read and dig into this indicator in more detail. So up at the very top, you're going to see the name of the indicator, the location you've selected, as well as a description of the indicator and then some text about why it's important. If I scroll just a little bit more, here you're going to see the current value for Ashland County, and then as well as some more information about where this data is coming from. So you'll see the data source, the current measurement period, who's maintaining that data, and even when it was last updated. And then to the right, you're going to see any various comparisons that are available for this specific indicator. So here you see we can compare Ashland County to other counties in the state and even across the country, as well as to the US value. And you're going to see a lot of colors and gauges and dials are used on the website, so don't be overwhelmed. 2 tricks are: one, you can hover over one of these gauges or dials and some text will pop up that will help you to interpret what that is saying. In addition, we also have a see the legend option over on the very far left of my screen. I'll just click that and then it'll pop open. Here you can see a description of the color coding and again, all those various gauges, styles, icons, etc. And all you have to do is just click hide the legend and that'll minimize. If this indicator was available for multiple measurement periods, you would see a graph right around here showing that trend over time, which, as Libby said, can be downloaded if there was breakout data available for the indicator. So for example, looking at it by age, there might also be graphs available there. And then just below that, you're going to see that there's also maps available. So right now we're just looking at the county level because that's what I selected. But if you were interested in looking at this indicator, maybe at a census tract level, you can go ahead and click on that. Pardon me while it loads. And then you're going to, you can zoom in and you can see that at a sub-county level. These maps are a little bit interactive, so you can add labels, for example. You can change the background map, the transparency, and then you can also download these maps. Let's see, here you're going to see all of the census tract values that we have available for this indicator, as well as a table showing those values. And I did want to point out at the very bottom of this page, right here, this download census tract indicator data. So you can download the indicator data on the website by clicking this. And then as Libby shared, another way that the website brings together related content is at the very bottom of these indicator detail pages. So here you can see other related indicators and even promising practices. So again, that's just a few ways to search for data and how to dig a little bit deeper. Next, I wanted to cover our specialty dashboards that we have available. And again, keep in mind that a dashboard is just a collection of indicators around a topic, location, or other element. So I won't cover the demographics dashboard because Libby did a great job sharing that. But again, just to reiterate that demographic data is available at the state, county, and zip code levels. So we do encourage you to use that. We also have a disparities dashboard. So I'll click on that. This dashboard is good if you're interested in looking at differences in health between groups. So you could use this dashboard to identify those groups to, focus your program and or maybe policy efforts towards. So this dashboard allows you to view indicators that have subgroup data available by race, ethnicity, age, and gender. And it can help identify populations who might be disproportionately impacted. So I'll scroll just a little bit so you can see what this looks like. So you can see how these different subgroup values might compare to the overall value. And again, these graphs can be downloaded. So that's the disparities dashboard in a nutshell. Another specialty dashboard is the Food Insecurity Index. So this is a newer tool that was created by our vendor, Conduent HCI. And this is a measure of food accessibility that's calculated using social and economic factors like household expenditures that might impact a household's ability to purchase food. And this can be used to identify areas in your community that are estimated to have the highest food insecurity. And in a nutshell, how this works is that all census tracts, zip codes, and counties are given a national index value. So those will range from 0 to 100, with 100 being high need. Then those national index values for each location in a community are ranked from 1 to 5, again, with 5 being high need. So on the map, the darker the green, the higher the estimated food insecurity. And I did want to point out that just below the map, there are options to filter. So for example, if I wanted to filter by Ashland County, I would just use these filtering options, and you can zoom in and make those adjustments over on the right. You'll also see a bar graph as well as the table for the food insecurity index, and you can download this data. It's a little bit small, but if you see this download icon, you can go ahead and do that. So another specialty dashboard is, I'll show the socio needs index next. So this is actually another tool that was created by Conduent. So this tool summarizes multiple socioeconomic indicators such as poverty and education, and it puts it into one composite score for easier identification of under-resourced areas. And this is also available by county, zip code, or census tract. So this tool highlights those socioeconomic disparities within a community, can be used to help with program planning, and determining where to focus your community health improvement efforts. And it works the same way that the Food Insecurity Index does. So again, all the census tract, zip codes, and counties are given that national index value, which are then ranked. So in this map, you'll see the darker the blue, would equate to that higher need. And again, you can use those filtering options to look, say, for example, at, oh, pardon me, all of the census tracts within Ashland County. And you'll see the same thing. So the graph, the table, as well as the option to download that data. And then the last specialty dashboard is the Healthy People 2030 Progress Tracker. So this progress tracker allows or shows you how a location compares to the National Healthy People 2030 10-year objectives for improving the health of all Americans. So you can use this dashboard to identify needs and priority populations, as well as to help set goals for your programs, and then to compare your community to these national targets. So you can see that this dashboard has either a green check icon or a red X indicating whether or not that target is being met. And the Healthy People 2020 targets are still displaying on the site. So those are the specialty dashboards. I did mention briefly that local data can be added to the website, so I just wanted to make everyone aware of that. So on this page, the search for data page, if you scroll just between or just below those search options, you're going to see some curated dashboards here. And those are just dashboards that are pre-built, customized dashboards that we create on the back end of the website. So they can include indicators that are maintained by Conduit. So for example, the social determinants of health curated dashboard is including data that Conduit maintains, but we can also add local data. So for example, for Cuyahoga County, we added some childhood lead poisoning data, as well as some select indicators from our last CHNA. So I did just want to point that out. So next, I'm going to show you one of the data-related tools that's in the Explore Data tab. So this is the option to build a customized dashboard. And I actually created one for time's sake just to show you. But these dashboards bring data together in one place to help you identify areas of progress or need. They allow you to see a summary of the indicator, as well as compare your community to other locations, national benchmarks, and to look at how that indicator might be trending over time. These dashboards are dynamic, so as the data on the website is updated, your dashboard will automatically be updated, which is nice. And these are really easy to share with partners. So you could use these to help with, reports, presentations, etc. So this is a custom dashboard that I created. And this includes some mental health and addiction related indicators, given that that was a priority in the Ashland County CHIP. So I'll just scroll just to show you what this looks like, but basically I've selected Ashland County as my location, and then I've added these specific indicators. So in this first column here, you're going to see the current value for Ashland County, and then to the right are any of those comparisons that are available. So if you wanted to make your own, I'll just scroll up now. Again, you would go to Explore Data and then build a customized dashboard. And these can be built in two ways. So there's a filter indicator option or a handpick indicator option. So the filter indicator option is better if you want to filter just by a topic area. But the handpick indicator option is better suited if you want to filter by specific indicators. And that's actually what I've done here. So you would start, this is just a drop down. You can either start typing or you can scroll down and select the indicators you're interested in here. The second field is your location, and keep in mind you can add multiple locations, so you're not limited to just one. There's other filter options such as filtering by comparisons, subgroups, or even your data source. So once you've made all of your selections, you would just click search, and then your dashboard will show below that. One thing I did want to point out is that these dashboards can be viewed in either a list or a card view. So we're looking right now at the list view. If I wanted to switch to card view, just below search results, you'll see this box icon. If I click on that, it'll show these indicator cards. And it's nice because you can save these individual cards, and I think they look really nice, especially for like a presentation in like a PowerPoint slide or something like that. So again, that's the card view. And then if you wanted to save this search to go back to it later or share it with someone, or maybe add a link to a document or even a website, you would just click save a link to this search, and then you can go ahead and copy the URL to share that with others. Excuse me. So that is, again, an example of a custom dashboard and how to create one on your site. So I'm going to go ahead and stop sharing, and I'll pass things back over to Libby, who's going to be sharing more about some of the tools and resources we have available.
Thanks, Sarah. And before we move into some of our tools and resources, we did receive one question in the chat that I think right now would be a good time to address that. We did receive a question from a participant about some of the categories and some of the data, and specifically about if every county has data. So I'm wondering if we can maybe elaborate a little bit more. And I know you showed the indicator detail, or pardon me, the indicator list by location page a little bit ago, but would you be able to elaborate a little bit more about the various levels of data that we have available and then how that differs maybe based on some of our different data sources?
Absolutely. And sorry if I didn't make that clear enough. So again, just to reiterate that the data on the website is available will be available at the state level for all of our counties, as well as the municipalities, zip codes, and census tract that make up those counties. The one caveat is that obviously that availability of the data is going to depend on the source that it's coming from. So for example, most ACS data is going to be available at all of the geographic levels, but we might have some things coming from, a state source or a more local source that might only be available at the county level. So you could look at the indicator list by location, again, if you're newer to using the site, just to kind of gauge, again, if you're interested in a specific topic area like cancer that I had used as an example, to see what indicators are available at the geographic level that you are interested in. But, we do have a pretty good variety. Obviously, county level is going to be the most common that you'll see, but we definitely have sub-county level data available. So, Libby, I hope that answers the question.
Thank you. Thanks, Sarah. And yeah, if anybody else has questions as we're moving through, please do feel free to enter those. And yes, we received a note in our chat that did answer the participant's question. So thank you for that. We're going to move into our next poll. So I'm going to go ahead and get that one open. So we are going to be asking you about how often you use secondary data. So we know that, and that should be open right now, but we know that people use secondary data for various reasons. And in this space, we know that it's something that differs from entity to entity, person to person. So we are curious to hear a little bit more about how often you use that. Maybe it's all the time, maybe it's only a few times a year, or perhaps hardly ever. And that's okay, because again, there are no wrong answers with this. We are hoping that if you are somebody that's a secondary data, power user, that this is giving you another resource for where to access that. And if you're not somebody who uses secondary data a lot, maybe this presentation today would help move you into a position where you would be able to capitalize on using it a little bit more. So I'll give it about another second or two. It looks like we've got some responses rolling in, and it does look like we have a lot who say a few times a year, a couple hardly ever, and a couple of people all the time. So that's great too. But we'll go ahead and we'll close this poll out, and we thank you for participating in that. Okay, so we are going to, and thank you to Sarah for that great overview for the data. I know that our data is very, very interesting and very, very appealing to many people in this space. So we hope that many of you are excited about all of the data that's available through the platform. And for right now, we are going to move into some tools and resources that are available on the platform. So under the Tools and Resources tab, you just heard a lot about what's available under Explore Data, but under Tools and Resources, we do have some great features that can help and assist your programmatic efforts. And we want to make sure that we point some of these out. So the first one that I'm going to show you is our Promising Practices page. And this is a database that's maintained by Conduent HCI, but essentially we have over 2,000 evidence-based practices, effective practices, and good ideas that are available in this database. And the ranking methodology can be viewed if you click on this hyperlink in the second half of this paragraph, or in the bottom of this description here. If you are doing a promising practice, or you're conducting an activity that you think would really fit well and that you would really want to share with, health departments, hospitals, and community-based entities across the nation, we really encourage you to submit a promising practice. It would be great if we could see some local programs pop up in here, and we would definitely support that. So we will walk through a little bit about how to utilize this database. We do have, as I mentioned, over 2,000 promising practices that are available in this database, and we know that that's a lot, and it could be very time consuming to go through all of those. So we want to show you just a couple of hacks to help navigate that search for a program. So as you were looking at some of the data earlier, and as you are navigating through the data on the site on your own, you might start to see gaps, you might start to see areas of need, and that might spark an interest in implementing a new program in a specific region. So that is what this database can help support. And I'm going to show you a little bit about how you could use the search filter to really narrow down your search. So we are going to do a keyword search, and I'm going to use diabetes as an example. As Sarah mentioned, we know that chronic disease is a priority in Ashland County's CHIP. As you continue to go through some of these filters, you can decide how or what kind of ranking you want to search for. So specifically, I'll click on evidence-based practice. And again, you can hover over that little icon to learn a little bit more about that criteria. If you had a specific target audience that you wanted to select, you could click that here. I'm going to go ahead and select adults. If you had any topics or subtopics that you wanted to filter by, and also if you wanted to filter by geographic type. And for now, I'm going to keep my search as is, and we will see what we get. And here you can see that we have 19 results that it's yielded rather than the over 2,000. So this is much more comfortable. Still a lot. So immediately, if you were interested in coming back to this later, you could click on save a link to this search, and you could save this and view it for later, email it to a colleague, and so forth. So the next page I'd like to show is what a promising practice page actually looks like. And the promising practice that I'll have us take a look at is the Healthy Diabetes Plate. And many of the pages for a specific promising practice will be, they'll look pretty similar to this one, but you'll have a brief description. As you move through the page, you'll see some information about the goals, the impact of that program, results and accomplishments. And then one of my favorite parts about these features or about this page of the site is that there's an area where you can get a little bit more information about who or what agency submitted this promising practice. So specifically, if you were interested in implementing this, but you really wanted to get a little more information or wanted to talk to somebody who has experienced this and worked through that in their own community, this would be a great place to get some of that contact information. In the upper right-hand corner, you'll also see related promising practices. So if you're doing a very comprehensive search, trying to gather all sorts of information about what's out there related to diabetes programming, you could continue to click through some of these promising practices as well. And then at the very bottom, this is another example similar to what we talked about with the topic center. This is an example about how intuitive our site is at bringing together related content. So here you'll see there are indicators related to diabetes that have populated here, as well as funding opportunities. And if there were other resources, those would show up here as well. So that's a little bit about the Promising Practices database. I'm a health educator by trade, so this is always something that I really enjoy presenting about, just because I know that many health educators and people in this space are looking for effective practices and evidence-based programs. So we definitely encourage you to check that out. The next resource that I'd like to showcase is our Vaccine Ambassador Toolkit. We do have a COVID-19 resource page that we're currently featuring, local and national links and resources, but the one that we specifically would like to talk about today is our Vaccine Ambassador Toolkit. And this is a great example too of how individualized we can be in responding to some of the needs of our partners. So this was actually something that was brought to our attention by some of our own community partners up in the greater Cleveland area. So they were looking to have a central location for some vaccine readiness information, and they reached out to us, and we were able to really build this custom web page to house all of the data, or pardon me, all of the resources available related to vaccine readiness that this group had compiled. So I'll quickly just scroll through this so you get a sense of what the page looks like, but we do have quick access links to view as a web page, to view one of our resource collections with all of these resources, or if somebody had a resource related to this that they wanted to submit, they could click on that link as well. So if I expand this out, you'll start to see the different videos we were able to embed, the different links that we were able to add here. And again, this was all in response to the needs of one of our partners. So we were very excited that we could feature this. And we will also mention that this page was featured in a webinar through Conduent HCI. So we were excited that they were able to feature that across the country to some of our other utilizers of the platform as well. So that was exciting. And I won't visit it today, but another example of how we could be responsive to partner needs was through the emergency preparedness resource page. Again, we heard from some of our partners that they were interested in having a centralized location for some of those links and resources, and we were able to create a page that looks similar to this one that we're on right now. Next up, I'm going to show you our funding opportunities database. This is a database maintained, again, by Conduent HCI. It features mostly national level resources for funding opportunities, but we do want to mention it just because we know that so many of our partners are looking for funding, whether it be grant funding, foundation funding for specific programs. So we did want to mention that this was a resource available to you as well. And lastly, the page that I will visit next is our resource library. And this is maintained by our team. So Sarah and I work to maintain this page specifically, so it's not maintained by our vendor. We have a lot of freedom with this one, which is nice. And you'll see here that we have over 300 resources in here, but this is basically a centralized location for different website resources, data tools, reports, webinars, videos. If we have any press releases or announcements, we can post them here as well. We have search options similar to the filters that we looked at with the Promising Practices database. We also have a search bar here at the top, so you could search, quickly by keyword if you needed to. And we have a lot in here. So this we can add things that are national resources, local resources, and we can be really specific even with resources that come directly from our partners too. So if you have a resource that you think would fit in our library, you can submit it here in this hyperlink, and we will view that and then potentially add that to our resource library. And then lastly, on our resource library page, I do want to point out our collections feature. So if you click on resource collections, this is a great way to look at some of our resources by topic, since again, I know having over 300 things to go through, it might be a little bit intimidating, but some of our resource collections bring together these by topic. So here you'll see we have some of our COVID resources kind of lumped together, ACEs, emergency preparedness, health equity. If we had any news or updates, so if we had a press release, specifically when we announced the partnership with Ashland County, we were able to add that to this collection, and so forth. So that's just another way to easily search for some of the resources that are available to you through that page. And then lastly, I'm not going to visit any of the other pages in the resource library, in the tools and resources tab today, but I did just want to mention a couple of the other resources available. We do have a 211 page where you can access information about your local 211, and also our ability to build a customized report is available through here, and this is something that Sarah will take you through in just a couple of minutes. And then lastly, we do have our CHNA guide, which is a tool that is maintained by Conduent HCI. And this is a great step-by-step guide for creating a community health needs assessment. So again, we invite you to explore those at your leisure, but for the sake of time, we won't be looking at any of those for today. And with that, I believe I am going to go ahead and pass it back on over to Sarah. So bear with me for just a moment while I go ahead and stop sharing, and I will pass it over to you.
Thanks, Libby.
No problem.
Right. Libby, can you confirm, are you seeing my web browser?
Yep, I'm seeing your report.
Perfect. Okay, so as Libby said, in the Tools and Resources tab, we do have another data-related tool available to you, and that's the option to build a custom report. The tool is technically called the Location Report Builder. So this tool allows you to build customized reports based on indicators and then a location of interest. And it is a really quick and easy way for you to pull together different components on the site into a downloadable PDF, and it can be easily shared with others. So these custom reports are a snapshot in time, so I just wanted to make that clear. So the data in your custom report would not be updated automatically like it would be in a custom dashboard. So just view this more as a static document. And you can create these reports really around any topic you're interested in. Like you could create, for example, a community profile. Like I know we've made some about demographics for our individual counties. You could highlight a specific topic, maybe priority area in your CHIP. But again, lots of options And again, I thought I'd start by showing an example of one that I created. So this is showing some physical activity and obesity related indicators for Ashland County, as that was the goal outlined in the chronic disease priority of the CHIP. So again, this is the finished product. This would be the PDF that you could save. You could, share this with others. You could add a link to this if you wanted on your website. So these reports are very customizable. So you can see here, I've only got 2 indicators, just again, for sake of example, but you can create or add custom text. So you could, call your report whatever you want it to be. And then you can add all of these various report components. So here you can see I've added a couple graphs. Here I've added that indicator detail card, which you may remember from the custom dashboard view. I've also added some text about what the indicator is, as well as the source that the indicator is coming from. And there's other options as well that I'll briefly show you. But again, this is just an example of a custom report that you can create. So if you did want to create your own, I'm going to go back to the website here. You would go to tools and resources and again, build a custom report. And you're taken to this page. So once you're in the location report builder, you're going to see here that you really can only do one thing. So it's very easy. Your first step is just to pick a location. So from the dropdown, I'm going to go ahead and select Ashland County. And now you're going to see that your toolbar is showing here. So you can go ahead and start adding content. So I would recommend next to start adding your indicators, which you'll do one by one. So to do that, you would just click the indicators button in your toolbar, and you can do a keyword search, or you can type in all if you wanted to see all of the indicators that would be available for you to pick from. So I'm going to just type in physical activity and do a search for that. So on the left here, you're going to see all of the related indicators that are showing based on my keyword search. So your next step would then be to select the indicator you'd like to add. So I'm going to go ahead and click on adults 20 plus who are sedentary. So now on the right, you're going to see these various report components are populated. So these include a variety of things. So there's charts, tables, text. You can even add an indicator card. You can add maps, and then those various text blocks like, what is this indicator? Why is it important? What's the data source? So I'll just select a couple. This won't look like the example I showed you, but again, just to give you a sense of what that looks like. So you'd select your components and then you would just click add. So once you've got those components in your report, you can start doing some additional customization. So for example, if I wanted to change my header, I would just click this pencil icon and a box would open where you could center your text, bold it, change the color, etc. You can also drag and drop components. So say I wanted this to be a lot smaller, I could just click and drag and make that smaller. You can even reorder components by using the drag and drop option. If you added a component but you aren't so happy with how that's looking, you can delete components by clicking this orange X icon in the top corner. If you then wanted to add additional indicators, you would just click indicators and then you could continue to add them. And at a certain point, there will be a page break, so the site will show you this red line just to make sure that your content's not going to be cut off. In the toolbar, I also wanted to point out that you can add demographics data to your report. So again, over here, you could select whatever category you're interested in and then the appropriate report components. You can also add socio needs index, which was that specialty dashboard that I showed you earlier. You can also add a map for the location, and then you can also add a legend. So if your report does include a lot of those gauges and dials, I'll just select all of these just to show you. You could add a legend just to help the person who would be reading your report. In addition, you can add custom text and then also these horizontal and vertical lines if you wanted to use those maybe to break up your report into sections. So say, for example, I'm happy with this report. I'd like to get a better sense of what my finished product might look like. Over in the right, you see we're currently in edit mode. But if I click on preview, it'll get rid of all those edit options. It's a little bit cleaner, again, just to have a better sense of that finished product. The last thing I wanted to show you is if you would like to save your report, in the toolbar on the very far left, you can click Save. So here you can download your report as a PDF, or you can even save it in your web browser if you wanted to come back to it later to make additional edits. So again, we hope that that tool is helpful to you in your work. You know, it's a nice way to help tell the story of your community, and again, you know, bring some of those indicators to life with some visualizations. So again, I'm going to go ahead and stop sharing. So that completes our website demo portion of the webinar. So I'll pass it back over to Libby, who will give us some final thoughts.
Thank you, Sarah. And as I'm getting ready to share, I do want to share one more page just since we have a couple more minutes and we are approaching our conclusion. So please do feel free to add any questions. If there are any last minute thoughts, we want to be sure that we address those before we wrap up for this morning. So just very quickly, I wanted to showcase our how to use this site page, and this is available under Learn More. And this has a lot of great how-to documents, step-by-step tools. And I do want to mention that we have video tutorials. I know that you've heard a lot of Sarah and I speaking this morning. So if you do watch these, you'll hear a lot more of our voices, but this is an option for some in-depth step-by-step video tutorials about how to use some of those features that we did cover today. So I did just want to mention those. And then also underneath Learn More, we do have a contact us page. So if you click on that, that will take you to a form which would allow you to get in touch with our team. But I will be pulling up our email addresses here in just a moment. So just wanted to make you aware of those items. So with that being said, we are approaching our conclusion for today. In summary, we did show you all about the data indicators available on the site. We talked a little bit about some of our custom dashboards, some of our resources and databases that are available to you, and then also how to use some of our data reports to hopefully assist with your own community health improvement planning efforts. And I will take this time to also mention that we are available to you for tailored demonstrations or presentations. I know that everything we covered today was very high level and it was a lot of information probably at once. So if there was a specific topic or if your agency works on specific initiatives tied to some of the topics available at the site, we are available for in-depth trainings and presentations as well. I will mention too that we have an upcoming webinar on December 14th, and we'll be covering community conditions, and we will specifically be talking about food insecurity. So that is part 3 of our webinar series. And again, that's on December 14th. And if you visit our website, you can register for that as well. So we did just want to point that out. And then I will go ahead and leave our contact information open for just a moment, just so you can take down our email addresses. Again, you can contact us through the site at any time, and you probably received some communication from us in preparation for this webinar. So we do encourage you to contact us at any time with requests, and we are always very responsive to emails, so we are happy to address any of those. And so Sarah, I'm going to look at you for a moment. Are there any questions coming through the chat box as we've been wrapping up here this morning?
Thanks, Libby. So I see the one question that we answered earlier, and then I just see a comment that says, this is also amazing. I can see this used for our cha and chips.
Oh,
so
great.
Thanks for that feedback.
Yeah.
So if anyone, we have a few minutes left. If you have questions for us, please feel free to drop those in the chat. I know Libby showed how to cite this page FAQ. So if you do use data from the site, I do encourage you to check out that FAQ again. It shows you our preferred method for that. And then I know one other common question that we always get is people ask, how often is the data updated on the website? And so I would say most indicators are updated on an annual basis. So all of that data coming from Claritas, for example, so our demographics data will definitely be updated on an annual basis, but it again just depends on wherever that data is coming from and how often that source releases updates. But I would say our vendor is very efficient. So if new data becomes available from a data source, Conduent usually has it up on our site within a few months. So if that's helpful, I thought I would share that because again, we get asked that pretty much every webinar we have. So Libby, I'm not sure if you have other thoughts. I'm
Thank you.
not seeing any other questions.
Yeah, I was just going to mention just a couple other final thoughts as we're wrapping up this morning, and we want to make sure that we're keeping to our time because we know that you're all very busy. We do have social media that we put out through the Center for Health Affairs social media platforms. So we do encourage you if you're ever in the mood to reshare or repost things. Again, I think I mentioned this earlier, but we really value our partnerships with all of the different counties in our community, but a lot of what we rely on for communication is word of mouth and just receiving referrals from people as well. So we do encourage you to share some of our content on social media. And if you feel like posting something, we invite you to use the hashtag HealthyNEO, and you'll see that right here in the bottom right-hand corner of our page. I also wanted to briefly mention our data dispatch. So we do have a quarterly newsletter that we send out via email, and we usually post, through that piece of work, we usually have updated things on the site. If we have upcoming events or opportunities, we will be having a regional convening this December, and so information will likely be in that, or you'll hear probably a little bit about that before we send the data dispatch. But we do invite you to take a look at that as well. And again, continue to share and feel free to direct people in your professional network to our site as a resource. And that is the last item that I wanted to mention, and I am not seeing any questions. So any final thoughts from you, Sarah?
No, just I appreciate everyone for joining us today, and please don't hesitate to reach out, as Libby shared, either via email or the contact us form on the website. We try to be really responsive, and we look forward to your questions.
Thank you, everybody. Have a great day.
Thank you so much. Bye-bye.